Hello, welcome to this week's screencast recording on the subject of modal choice, mobilities and health. In this week's session, I'm going to be introducing some of these broad concepts. There is a wide literature on sustainable transport and the relationship between transport and health. I've recommended some key texts at the end of this presentation, and there are a number of relevant texts available on the reading list and a very wide literature on sustainable transport generally. So I'm going to introduce some key concepts such as scales of health benefits linked to modal choice, the role of land use planning in developing sustainable transport systems. So that's kind of a small scale, large area approach. Relationship between public transport choices and health, walkability and active travel, and holistic urban design approaches to support healthy transport, healthy modal choice. So first of all, we'll think about these scales of health benefits, and this diagram crops up quite regularly in this module. And I think that's because this kind of principle of a holistic approach and understanding scales of impact, but also the point at which you intervene to bring about benefits is really important. So we'll be thinking about health benefits to the individual. So how can we look at individual levels of health and how a person can improve their health outcomes by changing their transport mode. But then we'll also look at the impacts of changing modal choice on neighbourhood, city and planetary level health benefits as well. And health benefits obviously can include the sort of physical health of the population, but it can also include things like the health of the sort of wider environment, and even you could think about sort of the health of the economy as well. Not focused so much on that, but it is linked to modal choice as well. There's no getting away from the fact that when we're talking about moving towards a healthy modal choice, we are looking at reducing car use. That isn't to say that there will always be people with particular needs that mean that they have to have access to some kind of personal transportation. But we can't really move in a more sustainable direction in terms of improving the health of any of those scales just discussed unless we reduce car use. So we are still kind of working with a legacy of that massive expansion in individual transportation that happened after the Second World War, and the impact that had on development patterns and land use patterns. Now we're starting to sort of tackle some of those legacies in terms of things like the impact of transportation from an environmental perspective and from a health perspective. So having a large volume of traffic increases road traffic accidents. So we have that kind of those impacts as well. So roads are not safe, and roads dominate areas, and it reduces all of those kind of possibilities for more active travel. Car use is a sedentary mode of travel, so you aren't actually getting the individual level physical health benefits of moving around from place to place if you just walk from your front door to your car and then from your car to wherever it is that you're going to. So there is that health impact as well. Obviously, emissions are a really key one. So air pollution linked to transportation is a massive problem. It's also important to recognise that in terms of intervening to make a change, cars compete for space with other modes of travel. So we don't, there is a body of literature that kind of looks at that in terms of practices, social practices, and there is this idea of competition between the modes of travel. So the more cars there are on the road, the less safe it feels for cyclists, the less safe it feels for pedestrians, the less efficient public transport infrastructure can be because it's literally queuing up in the traffic alongside cars. So there is also thinking about that shifting of priorities towards different modes of transport. And cars were not designed for the compact city, as we've already just mentioned. There was this wonderful sort of utopian idea that we would spread out and everyone would have their own low density area of development and their own car, and we drive everywhere, and no one really kind of anticipated the expansion in demand and the expansion in population and what that would mean for the congestion of the road systems and also the environmental impact of that. So compact cities where everything is walkable in close proximity with a good transport infrastructure um, really compete this idea of everybody having access to a car. So public transport has a direct impact on health because lots of those things that was just mentioned there. Um, Even if it's a small amount of walking or cycling or some kind of linkage in terms of hooking up with your public transport infrastructure, it's actually a more active way of travelling. So it's part of an active travel network. There's no real suggestion that everything anyone ever needs to access should be within walking distance. That's not really feasible. But if you're looking at active travel options that link up with a really sort of well integrated public transport infrastructure, then you start to increase people's individual mobility. It does also support this idea of compact city design. So you can have a more walkable area that is connected through public transport infrastructure, mass transit systems, because you're not trying to make space for all those individual cars, which is obviously a very inefficient way of getting lots of people around in terms of space. If you have a very good transport system, it incentivizes taking cars off the road. So it doesn't make sense to drive. It isn't more pleasant to drive or more time efficient to drive if you have a really good and affordable public transport network. And it also offers opportunities for social interaction. Now, that might not be something that everybody thinks is a positive about public transport, but even if you're not actively interacting with people, the fact that you're kind of out and you're in the same space as people within your community, queuing for the bus, waiting for the train, then there is a form of social interaction there. So it is actually a way of kind of reducing those deep levels of isolation that can be experienced in communities. Walkability, as a kind of catch-all term, is really gaining a lot of traction as an idea. So walkability, so let's move myself away from the text there. Walkability as a term includes all forms of active travel. So we're not just talking about walking, we're skating, cycling, different kinds of mobility aids, scooters, running, kids on scooters, that kind of thing. But walkability is not only the sort of the physical infrastructure, so good paths, good connectivity, but also design that encourages and actively encourages people. People want to actually get out and walk around an area. So it's a wider urban design aspiration. And there are obviously multiple benefits as outlined in this diagram. It improves your physical health, your emotional health. It saves you money. You don't need to pay for transport. You're more connected to your place. That it increases levels of community safety and connectivity. And then obviously the wider environmental benefits, more active travel, fewer vehicles, and all of the environmental benefits and environmental harms that they bring. So it's really part of a kind of wider, holistic, sustainable, and healthy approach to urban design is to make places walkable. And one of the things that I'll be asking you to think about ahead of the session is kind of understanding what the features of a walkable neighbourhood are and how you can evaluate an area for its walkability. And again, walkability means really active travel. But the more contentious element of walkability, of course, is that, again, this theme running through this session is that you can't have walkability and lots of space for cars and lots of parking as well. You can't have the two. The two things are mutually exclusive often. So there is always that kind of again, and as planners you're used to this, but there is that kind of wider benefit that you are making the case for meeting resistance from people who actually don't want to change their patterns and don't want to be involved in that process of moving away from what is a very successful form of transportation for lots of people, towards something that has kind of wider community benefits and deeper benefits for people's health. One of the things that's been really interesting to observe through the COVID-19 pandemic has been uh, this kind of consolidation of this idea of the importance of the neighbourhood. People haven't been travelling as far to access services, and lots of those services haven't been available. But what has been available are the local neighbourhood services, and those have become really valued. And of course, that's something that has been promoted through kind of planning and urban design theory and best practice for quite a long time now. And it is a fundamental shift away again from that kind of post-war zoning approach to land use, which was very keen to separate and have services in one place, and kind of these hubs. And now we're actually looking at a more kind of a fragmented approach where you have smaller conurbations with localized service provision. And a lot of that is to do with what that offers in terms of opportunities for changing modal choice. So we have this kind of idea of easy accessibility of services within the local area, and then good connectivity of kind of larger infrastructure outside of the local area, um, but but it's sort of denser, more uh, denser neighbourhoods that support that public transport infrastructure as well. So you walk and travel actively around your neighbourhood and access a lot of the things that you need there, and you don't need to drive. But then if you do need to access things that are outside of your neighbourhood, there's good connectivity on public transport to support that. And this idea of the 20-minute neighbourhood, which again, as I referenced this in a previous presentation, and there are resources in the resource section of Blackboard on this. This idea of 20-minute accessibility on foot within the neighbourhood of all of these different key services, it has a really profound consequences for how we design and shape our cities. If we're actually thinking that people need to be able to access this whole range of things within a 20-minute walk, that sort of changes our transport needs quite fundamentally. And to finish this presentation by revisiting an old friend, the city of Freiburg, which I know that you have explored as a case study on other modules before. But to just to sort of revisit particular elements of that you will be familiar with, Freiburg is utilised as a case study for many aspects of sustainable urban design and sustainable urban living. But one of those is its transport infrastructure and its holistic approach, and it kind of the interventions at a number of different scales around modal choice change. So one of the most sort of fundamental underlying benefits of the Freiburg model is that for a very long time they haven't shied away from waging war on the car. It's not easy to drive around large areas of Freiburg, and therefore there are better options and people take those options. So there are certain areas, primarily around the Altstadt area, the centre of the city, which is this area here. And that is car free, and it's also bus free. So there's only pedestrians, cyclists, and trams in the centre. So active travel modes and trams, and that means that people don't drive around the city centre, which makes it very walkable. But then you have other disincentives for driving as well. So car parking is not is expensive, and there's not a lot of it near to the city centre. Um, and there are the car restricted neighbourhoods that you already know about, Rieselfeld and Vauban, where they're not car free. Rieselfeld particularly isn't car free, but it is car restricted. So they are not. It's not primarily a neighbourhood that you would try and drive around. It doesn't really make sense to do that, and you certainly wouldn't drive into the city centre. So that kind of car traffic is severely reduced. So they didn't shy away from that, and that is kind of the stick element of the Freiburg transport model. the carrot is their fantastic integrated, reliable, and affordable public transport system. So these you have these opposing kind of forces acting upon the population to encourage them to make a modal choice. It becomes the far more sensible option, which is, I think, a problem that we have in large areas of the UK. It isn't. It's still more expensive and more inconvenient to use public transport. Not the case in Freiburg. So trams only in the city centre. Those link up to bus networks. They are connected by the timetable. They have a single ticketing system that's quite heavily subsidised, and they also physically connect to the rail network as well. So you can arrange your travel very easily, and you're going to know that all the elements connect up and will run smoothly. And that combined with making it difficult to drive makes this transport infrastructure very sustainable, very well used, even though it's quite heavily subsidised. Of course, as well as having a great public transport infrastructure, it is designed to support active travel through different forms of urban design. So cycling is very popular. There's lots of bike storage. There are well maintained cycle paths that are separate from the roads. So there's a priority given really to cyclists over car users. It's a compact city design again, so you have that concept of sort of neighbourhood walkability, and those areas that are too far to walk are connected well with public transport. Um, it's a city that gets very hot in the summer and very cold in the winter, but there's excellent green infrastructure, green corridors, which mean that, again, active travel is supported because you can be kept cool and shaded whilst you're on your active travel journey. And again, those car-free areas. So remembering that kind of competition for space, it's not just that it's difficult to drive, but the fewer cars there are, the nicer other forms of transport are, and the more efficient they are, the more environmentally pleasant the environment is, the safer the environment is, the more likely you are to let your children ride bikes, for example, as seen in the picture here. So in summary then, when we're looking at health benefits of modal choice, we have to think about that number of scales. Um, there are benefits to the individual by encouraging more active travel, but then the impact of a reduction in air pollution has implications on many scales, and it doesn't stop really until you get to the global scale. So if globally we want to tackle kind of climate change issues and pollution and temperature rises and things, we need to clean up the air. And a major step towards that would be to reduce the number of individual car journeys that were being taken place. And these are all the reasons that we've discussed. And the health benefits, again, are kind of interrelated with air quality and physical activity, the safety of space, and the way that all of those different elements work together to encourage people out of their cars, onto their bikes, onto their feet, and onto the tram system or the bus system. The literature around the areas of sustainable transport and the relationship between transport and health is quite challenging. I have to be honest, it's not my favourite area of literature at all. These are some key texts that I am offering to you if you want to read around the subject in more depth, and if it's something that you're thinking of focusing your evaluation on. But the text that we're going to look at in the session is, hopefully quite accessible one. So enjoy the key reading, I hope, and I look forward to seeing you in class.